Chicago Municipal Tuberculosis Sanitarium had a positive impact on Northside Chicagoans and continues to positively impact its surrounding communities as a whole.
Extending the legacy of the beloved Tuberculosis Sanitarium, the land of North Park Village was and remains to be a memorable component of the neighborhood. Tuberculosis is a lethal disease that affects nearly a third of the world's population and kills more than 1.3 million people every year. Despite its severity in other parts of the world, tuberculosis is nearly dead to the American population today. It is caused by Mycobacterium tuberculosis, which generally attacks the lungs, but in some cases it attacks other parts of the body, such as the brain, kidneys, and spine. Tuberculosis was once a very deadly disease that took the lives of hundreds of thousands of people every year, and became America's most deadly disease in the early 1900s. Tuberculosis was especially detrimental in large cities because of unsanitary housing, poverty, factory jobs, and overcrowding. These problems were very evident in the northern Chicago neighborhood of North Park. This was because Swedish, German, and Czech immigrants flooded into this neighborhood.
The city of Chicago established sanitariums in other parts of Chicago to help quell the disease. However, tuberculosis was still a huge problem, especially on the north side of Chicago, as the other sanitariums were located either downtown or on the south side. In the early years of the 1900s, the Peterson family donated 160 acres to the city of Chicago. Chicago decided to use this land to build a tuberculosis sanitarium on the north side of Chicago. On May 2, 1911, William A. Otis and Edwin H. Clark were appointed head architects of the sanitarium, and they began their 2 years of construction. Theodore B. Sachs was made the chairman of the Committee of Plans for the sanitarium after years of free work with tuberculosis patients all around the country. He worked regularly with Meyer R. Lithstein, the medical director of the sanitarium. On March 1, 1915, the Chicago Municipal Tuberculosis Sanitarium opened on 5601 North Crawford Avenue. It was the largest in the entire country and included administration and service buildings, 2 dining halls, a powerhouse, and several infirmaries and cottages for patients. The sanitarium left ample space for farming and gardening so the patients could spend time outdoors, as fresh air was one of the treatments for tuberculosis. The sanitarium had a capacity of 1,000 patients, 300 beds for ambulatory cases, 16 cottages, and the first pediatric ward. This pediatric ward started out with the capacity for 20 infants, both infants whose mothers have tuberculosis and infants diagnosed with tuberculosis, but this capacity grew with demand. The sanitarium had 2 wings, northern wing for women and southern for men. Although this was for safety purposes, Joseph C. Mayer, a patient in 1943, was not a big fan of this rule, as he describes.
There were some fairly good-looking woman patients out there. There was a rule against visiting them. That was a silly rule.
The large size of the sanitarium was perfect for the newly crowded North Park neighborhood. Furthermore, the sanitarium offered free admission to the residents of Chicago. These aspects greatly benefited the immigrants as the sanitarium could accommodate the large population and their financial situations.
In the year 1915, approximately 171 per 100,000 Chicagoans died each year as a result of tuberculosis. This large rate was cut in half to 80 per 100,000 Chicagoans by 1961. In 1916, Chicago was in the top 26 large cities with the lowest death rate from tuberculosis. This improvement was due to the healthcare programs at the Chicago Municipal Tuberculosis Sanitarium. The sanitarium had an extensive X-ray program where the sanitarium gave free X-rays to all who applied for admission. The sanitarium also had a mobile X-ray unit that traveled around the city to tuberculosis-prone areas and provided free X-rays. This program helped catch tuberculosis in its early stages, which was crucial in lowering the death rate of tuberculosis. There was also a dental, orthopedic, and surgical ward, which was used to help keep the patients as healthy as possible to expedite healing. The sanitarium also provided a free preventative treatment to children in contact with tuberculosis, called isoniazid, as well as free take-home medications for former patients. By 1961, a tuberculosis vaccine was available, and the sanitarium began a program at the Cook County Hospital and gave all newborns a vaccine. Aside from medical treatment methods, the sanitarium helped to boost the morale of the patients by having dinner parties, board games, movies, a library, and vocational training for extended stays. The entertainment provided by the sanitarium elevated spirits and helped the patients improve. As John C. Mayer described,
On the whole, the sanitarium life wasn't so bad. We used to play chess, checkers, rummy, poker, or pinochle.
to help prevent tuberculosis in children, the sanitarium hosted a summer camp for both healthy children and children recovering from tuberculosis. This camp focused on healthy exercise and play in fresh air to prevent tuberculosis and concentrated on weight gain for those recovering from tuberculosis.
In addition to the effective methods of treatment, the Chicago Municipal Tuberculosis Sanitarium provided information targeted to prevent the contraction of tuberculosis to its patients and the residents of the area. The sanitarium warned people against the very causes of tuberculosis, such as crowded, unsanitary, and low-ventilated housing and dirty, suffocating, and crowded factories. The sanitarium exalted fresh air and ventilation. In fact, children were advised to sleep outdoors to prevent tuberculosis. Unhealthy living and working conditions were not the only ones cautioned against. The sanitarium also alerted civilians of bad doctors that performed incorrect diagnoses. This propaganda was translated into a multitude of languages for all the immigrants so that they could prevent tuberculosis as well.
With the rapidly diminishing number of tuberculosis cases in Chicago, the need for the 160-acre, nearly $3 million sanitarium was almost non-existent. After 59 years of operation and over 250,000 treated patients, the underused sanitarium came to an end in 1974. In an article regarding the bittersweet closing of the sanitarium, Rosemary Flaherty, director of nursing at the sanitarium, expressed,
"We hope that it will live again to serve the community for a useful purpose, such as a medical facility for the rapidly increasing segment of our society, the elderly."
Usually the city decides to plow down every piece of open land and construct residential or commercial buildings, but the Land of the Seas Sanitarium became an exception to the city. In 1974, 13,000 residents of the area were surveyed on their opinions regarding the fate of the land. Due to the work of many community activists who pushed to preserve the land as a recreational area for the community, Rosemary Flaherty's vision for the Land of the Sanitarium was a success. The city of Chicago redeveloped the land into what is now called North Park Village. The dining halls and cottages where tuberculosis-infected patients once roamed were redeveloped into 180 senior citizen apartments.
Other buildings, including the service and administration buildings, were redeveloped by the Chicago Park District into a gymnasium and a recreational center. The recreational center, as seen behind me, includes a gym, art and recreational rooms, and a dance studio. Several art and dance classes are offered to citizens of Chicago, as well as gymnastic and ballet training. The remaining 24 acres were transformed into what is now called Peterson Park. It includes 2 playgrounds, 4 tennis courts, 2 soccer fields, a full basketball court, 2 baseball fields, and a walking and biking path which stretches throughout the entire park.
In addition to Peterson Park and the residential housing, the land contains a more scenic area known as the North Park Village Nature Center, which is often referred to as a hidden gem of the city. The land includes paths through a forest, prairie, wetland, and oak savanna. The Nature Center is free, and visitors are sure to spot a deer or two. The Nature Center also contains a recreational building with entertainment for all ages. This building was previously the dispensary for tuberculosis patients in the days of the sanitarium.
While the sanitarium was a great advantage to the city of Chicago, the Land of the Seas Sanitarium remains to largely benefit the community by providing free programs, activities, and recreational areas for all Chicago residents, just as the sanitarium provided a free beacon of healing for patients of all types.